How is COVID-19 amplifying the challenges women with disabilities are facing?
So we hear in the news quite regularly that there's a surge in domestic and sexual violence. That's the case here in the UK, and it's a worrying trend around the world. In fact, in Kenya, since COVID-19 arrived, 1/3 of the crimes reported are related to sexual violence. And we also know in some contexts that violence conducted by a partner of an individual has increased as much as threefold. And some of this is linked to people being in prolonged periods of lockdown in the house. Some of it is related to the added economic stresses that are being caused by the repercussions of COVID-19 impacting people's jobs and livelihoods. We know that women with disabilities are more at risk in general of sexual and gender-based violence, including domestic violence. So we know that they will therefore be disproportionately impacted by the surge in this kind of violence that we're seeing in the face of COVID-19. In some contexts, social norms dictate that women and girls are the last to receive medical treatment when they need it, and we know that that's also the case for women and girls with disabilities. So if we think about that in the context of COVID-19, if somebody becomes unwell with COVID-19, if they're a woman, they might be less likely to try to access treatment or take longer to access treatment, meaning they might become more ill before getting support. We also know that some people with disabilities are at a greater risk of contacting COVID-19. This includes women with disabilities, and this could be due to barriers in accessing hand washing facilities or performing hand washing tasks due to their impairments. It could be due to difficulty to follow social distancing for those that need contact with caregivers to carry out daily tasks like dressing and eating, and also due to public information about COVID-19 not being shared in accessible formats. What we're starting to see is that women and girls with disabilities, and sometimes the female carers of people with disabilities, are starting to face a range of new barriers in accessing sexual and gender-based support services. And these barriers are multiple. For example, the services themselves might be disrupted, and they may not be available due to COVID-19 and the lockdown. The services might not be accessible because the transportation mechanisms to get to them may not be functioning.